I'm Dr. Michael Holland. I'm a OBGYN with Southeast Obstetrics and Gynecology at Women First. So the weight gain that occurs when in perimenopause and menopause ultimately comes down to age changes, and they're not specific to the hormone changes. Really, weight comes from an excess of energy and a lack of energy expenditure. So for most people, that's an excess of calories or just eating too much relative to how much exercise or physical activity you do. Genetics don't play much of a role with the weight gain per se. It may have some factor in what your basic metabolic rate is and how hormonal changes with age, but ultimately it comes down to that energy imbalance. The weight gain that can occur after menopause poses a lot of risk. It increases the risk of cardiovascular disease, diabetes, cancers, in particular to women. There's a very large increase in risk of endometrial cancer and breast cancers, as well as several other cancers and health consequences. The weight gain that occurs around the abdomen after menopause is primarily due to the drop of estrogen. The overall gain of weight is still an energy imbalance, but with a drop in estrogen, more of that weight goes into the abdomen. And that abdominal weight gain is deeper. It's not the type of fat that you can feel, it's around the organs. That organ fat or visceral fat is a more dangerous type of fat, and those fat cells release hormones that cause all the other health consequences. So the cardiovascular disease, the increased risk of cancer. The major lifestyle changes that a woman can do to help prevent weight gain in menopause are changing your diet to incorporate a calorie deficit diet. In other words, taking less energy that you're burning, and then also increasing exercise. That will help maintain the body composition, the muscle mass that will help keep your metabolism up and prevent excess fat gain. Stress can play some role in weight gain. Not only does weight gain cause other psychological disorders, so it can cause anxiety and depression, which then causes more overeating and more weight gain, and it becomes a cyclic nature. High levels of stress and high levels of cortisol can also change your metabolism and how that excess weight and excess fat is deposited. There are some medications that can change how weight is gained. Some medications for high blood pressure or diabetes cause more weight gain than others. And particular to women, hormone replacement with estrogen can mitigate some of that abdominal weight gain that occurs as estrogen levels fall. When it comes to exercise, the general recommendation is about 150 minutes per week, but that's for general health. Really, for weight loss, you need to be closer to 250 to 300 minutes per week to get into enough of an energy deficit to lose weight. And that's moderate level exercise. So in other words, you can hold a conversation, but you can't sing. That exercise is really a combination of aerobic exercising, so walking, but also doing some kind of resistance exercising. That resistance exercising, that weightlifting exercising will help maintain muscle mass, which also helps promote maintaining that metabolism that will burn more calories just at rest. So I think the most important thing to take away when we as healthcare providers are addressing excess weight or the disease of obesity with a patient is that we really look at it as a chronic health problem. It leads to all these other health problems like diabetes and hypertension and cardiovascular disease and cancers, which for women really are much higher risk and more likely to die from than any of the gynecological cancers that we deal with. Thank you for watching. If you have any further questions about menopause or with excess weight, please feel free to contact our office.